Welcome to Joint Session Diverse Voices in New York State Cannabis. I'm Herb Barbot, former and first Director of Operations at the New York State Office of Cannabis Management. This podcast brings together policymakers, regulators, licensees, advocates, and industry leaders to talk through the realities of building a cannabis market in New York and what those lessons might mean beyond the state. In Season 3, we continue the conversation while we celebrate the 5th anniversary of the Marijuana Regulation and Taxation Act. We look at how policy translates into practice and how practice may impact policy. Through it all, businesses must navigate change, all while trying to prepare for where the industry may be headed next. We aim to bring you thoughtful, candid discussions about what's working, what's evolving, and what still needs to be figured out. Thanks for joining us, and now here's the episode. Dr. June Chin is a nationally recognized expert in cannabis therapeutics and integrative medicine with over 2 decades of experience at the intersection of patient care, public health, research, and regulatory policy. As Chief Medical Officer at the New York State Office of Cannabis Management, Dr. Chin leads the agency's public health initiatives, clinical engagement strategies, and evidence-based cannabis research. Prior to joining OCM, Dr. Chin founded and operated integrative medical clinics across California, New York, and Connecticut. Dr. Chin has also served as Vice Chair of the New York State Cannabis Advisory Board, where she helped shape key initiatives related to medical access, research, and safety. Through her leadership, she remains committed to building a cannabis framework that prioritizes patient well-being, community trust, and scientific integrity. Welcome, Dr. Chin.
Thank you so much, Herb. I'm really looking forward to speaking with you today.
And so am I. Thank you very much. So, Dr. Chin, can you just start off by providing a high-level picture of where the New York State Medical Program stands today and how the program may have evolved since the initial launch?
Absolutely. I guess I'd start by grounding us in why we're here, right? Because, as you know, policy details only make sense once the bigger story is clear. So, over the last few years, New York did something hard and important. We changed the law, we expanded access, and we moved forward. But as that change moved into the real world, something else started to show up. And not in legislation, but we started seeing it in emergency rooms, pediatric offices, OB practices, primary care clinics. And clinicians began asking the same questions. One, how do I talk to a parent who's unsure about what their child was exposed to? How do I screen a pregnant mom in a way that is non-stigmatizing and evidence-based? You know, what does safe use even mean in practice? And where does my responsibility as a clinician begin and end? So what we realized is that cannabis didn't arrive in people's lives in a neat regulatory category, medical use, adult use. It arrived as a health reality, showing up across the care continuum and often all at once. And the system, the healthcare system, wasn't fully prepared for that moment. And this is not a story about the medical cannabis program versus an adult use program. And you'll hear me say that over and over again. It's a story about access and about timing and health equity. And I think in New York, we built access faster than we built health system readiness, if you will. So the question is not whether cannabis intersects with healthcare. It already does. The question is how New York chooses to lead that next chapter proactively or reactively. And that's one of the things I wanted to talk to you about today is the Center of Excellence for Cannabis Health and Equity, and Cannabis Care and Health Equity. And that is Governor Hochul announced the Center of Excellence for Cannabis Care and Health Equity as part of her State of the State a couple of months ago. And at OCM, we are moving forward with this work programmatically. So you can see, where the medical program began years ago, then into adult use, and now we have the Center of Excellence. It's really about helping clinicians navigate everyday clinical questions. We think about safe storage in homes with children, counseling around youth use. Again, I bring up OB because screening and advising during preconception, pregnancy, postpartum periods, right? Those are conversations that my colleagues, my OBGYN colleagues are having. And then neutral evidence-based conversations with patients. So really the goal here is not, promoting use, but it's to making sure clinicians feel prepared to address the risk, safety, and uncertainty in routine clinical care.
So now today, how many registered patients are there? And has that number been increasing, decreasing, pretty much holding steady?
Now, I get asked this all the time. How many registered patients? And I don't think we should concentrate on that number. How many registered patients? How many certified clinicians? This
There goes my
is
next question. No.
well, this is a care continuum. If we keep thinking about it as in how many patients are registered in the medical program, we lose sight that the cannabis care continuum is in medical and adult use programs. When we think about how many certified doctors are there, we want clinicians to be able to refer to colleagues, a rheumatologist that can understand cannabis care and speak about it, or refer back to another neurologist. It's not about how many doctors, it's not the numbers, it's really about the competency, cultural competency, clinical competency, and how do we discuss this across the continuum of care. So I don't go by numbers because I think that is a misnomer on how we should
Are those
approach.
professional conversations happening? Are doctors having those conversations with patients? Are they making those referrals to other specialties?
Exactly it. That's why we are hands down on the Center of Excellence, is to make sure that clinicians are having these conversations with patients in the day to day. Perhaps not saying, do you consume cannabis, tobacco, and alcohol all in one sentence? But how do we frame, are you using plant-based medicine? So that the patient is not defensive and thinks about, well, did I just do something wrong because you just looped it in with these other drugs? But am I using plant-based medicine to manage my anxiety? Well, have you thought about other prescription medications and how that's interacted with you? How often are you using it? Are you storing it away so that if there's children or pets in your home, they don't get a handle of it? So it has to be in the context of the continuum of care.
All right, so I'll skip the question. I didn't have a question on the number of physicians, but what conditions or ailments are patients most commonly, using medical cannabis to treat? And are there any new or emerging approved conditions that patients are asking about?
So clinicians can approve medical cannabis treatment for whatever they deem is appropriate through standard of care. So there's not one particular condition that's qualified or non-qualified. It's the clinician has to use their judgment. The most diagnosis that we see in our data is chronic pain. I would say chronic pain all across the board, and that can be musculoskeletal, that could be chronic pain from cancer care, that could be chronic pain from diabetic neuropathy, like maybe your feet, you're losing feeling in your feet and your hands because of your diabetes. So that could be chronic pain. Insomnia, so sleep disruption is another one. And then I would say anxiety would be the other.
So now and this may be a little bit of an unfair question, but is the medical program still relevant today, right? With the growth of adult use, and the patient being able to just walk into the neighborhood dispensary as opposed to going to a medical dispensary.
Medical cannabis will always be relevant. When you have the ability to speak with a pharmacist about medication interactions, when you have the ability to have a patient certification and use that as a springboard to speak with your other clinicians, it does have a statement to it when you've been recommended medical cannabis by one of your specialists, and you talk to your primary care or your GYN and say, my PCP recommended cannabis care. It changes the conversation. So I do think medical cannabis will always be relevant, and I don't want to dismiss that just because there's adult use dispensaries and wide access, the therapeutic care is still needed, right? So when you walk into a dispensary, you might not want to see your clinician right away because it takes 6 months. I mean, think about it. How long does it take to get into your internist or your primary care? It might take 6 months, and you might say, you know what, my neighbor uses cannabis for their sleep disruption. I might try that as well. So you walk into adult use dispensary. However, the therapeutic guidance is still needed there. And so that medical cannabis dispensary still plays a role so that consumers and patients alike have that access.
Now, are there specific populations such as veterans or seniors, individuals with serious illnesses for whom the medical program is especially critical?
Absolutely. I think as consistency, as cost savings as well, the medical cannabis program is still very relevant. And I'm glad you brought up seniors. I just did a presentation for the NORC community, naturally occurring retirement communities in the Office of Aging. And one of the top one of the top concerns of the aging population is, can I take this safely because I live alone? Right? Am I going to take this gummy and in the middle of the night I need to use the restroom? Am I going to fall? Is there a fall precaution there? So I think going into a medical cannabis dispensary, talking to a pharmacist, bridging that collaboration of care with their clinician is very important, especially when it comes to elderly or vets who are disabled, who might be on workers' compensation, for example. So these are the nuances, these are the complicating factors where a medical cannabis certification, a medical cannabis dispensary plays a key role.
And you just mentioned something that sort of reminded me of another sort of key difference between adult use dispensary and a medical dispensary is that the medical dispensary has to have some kind of access to a pharmacist.
That's correct. The pharmacist is always there to review anything, and that just brings that level of care as a clinician, as a health provider. So when you go to an adult use dispensary, you don't often get that, right? The bud tenders, the retail staff behind the counter are not trained in the same way that health practitioners are. So having that ability to go to a different dispensary for a different caliber of care is valuable.
Right, and that's actually been a warning to a lot of bud tenders, to be sure not to be providing, health information or what they think is health information.
Yeah, and I'll to give you an example. I had a patient a couple of years ago who was using cannabis at an adult use dispensary for her anxiety, and she was doing really well, was helping her anxiety. But after month 3, month 4, she kept going. It didn't help. When she went back to her primary care doctor, she realized it was a thyroid issue and a blood pressure issue. So it wasn't anxiety to begin with, right? So obviously the bud tender did not mention like, oh, it could be your blood pressure, your thyroid medication. It looks like you haven't refilled it. Could you go back to your primary care doctor? That's that health gap that the medical cannabis dispensary would give you.
So for listeners who never engaged with the program, can you sort of describe what the process is from thinking that you might, qualify and be interested in medical cannabis to actually, seeing a physician and getting the actual product?
The number one thing is to talk to your clinician, right? The more you talk to your regular clinician, going through your regular insurance care and your clinician, the more clinicians will realize as a whole that patients are asking for better information. And I, as a doctor, I, as a health practitioner, a nurse practitioner, a PA, I have to get educated. So the number one thing, ask your clinician. Number two, you can go to the OCM website. There are a list of clinicians that specialize in medical cannabis or is willing to integrate cannabis into their healthcare continuum. So you can take a look at that. And then the list of medical cannabis dispensaries, of course, are on their website as well.
Now, in New York, who's allowed to issue that medical cannabis certification? Is it only physicians, or can nurse practitioners, other providers also certify patients as well?
Yes, absolutely. If you can write a prescription, then if you have a DEA license, essentially, and have access to the health commerce system, then you can write it. You can recommend it.
And what about fees to the patient? Insurance, does insurance cover medical cannabis in New York? Are there any financial assistance programs for low-income patients?
Unfortunately, not. Insurance does not cover it. Insurance can cover the visit, so that's why I encourage patients to see their clinician so that it can be part of their visit. It doesn't have to be a separate visit. You can talk about your blood pressure medications, your diabetes medications, your GLP-1 medications, along with your cannabis care, and that should be billed under the same visit. But the medical cannabis itself and the cannabis medicine itself, usually not covered. There are some creative ways where I've seen out-of-network health insurance plans, HSA or flexible savings accounts, where patients have used that, and it does cover it. Workman's comp as well. It's a long paperwork process. I hope we can work on that, but there is some limited coverage as well.
And what about fees to get certified and get that card, et cetera?
Again, that's what I'm talking about.
Oh, okay.
I think that patients should not have to pay out of pocket for that extra fee. Clinicians that are already in their network, that are already their primary care doctor, internist, GYN, rheumatologist, should be able to certify the patient within that visit and bill insurance, Medicare, Medicaid, or their insurance, HMO, PPO, during that visit.
So today, what would you say are the biggest misconceptions about medical cannabis, that you wish more New Yorkers understood? And are there still misconceptions in the medical community itself?
I think there are a lot of misconceptions about medical cannabis versus adult use cannabis. I think the lines are very blurred. The products are very similar. When you look at adult use dispensary, there are hundreds of SKUs that are very similar to the medical cannabis dispensaries that you'll find. What you tend to not find in adult use dispensaries are higher CBD products and products that are lower in THC. I think that is a gap that we are continuing trying to address, but the medical cannabis dispensaries do cover more of those types of products. And a lot of patients, again, elderly, you brought about veterans, sometimes children, right? They require those low THC, high CBD products.
Got it. And what about misconceptions in the medical community?
I think the misconception in the medical community is that it's a last resort. A lot of my colleagues will think about medical cannabis as only for cancer patients or only for palliative care when you've tried and exhausted all options. I encourage my colleagues to think about it as an integrative approach. You might want to use it alongside your prescription Celebrex, your prescription neuropathy medications, so that you can offset some of the side effects of the prescription medications and you can enhance some of the pain relieving effects that medical cannabis helps with.
So what guidance do you provide to clinicians about how to have this conversation, how to begin this conversation with their patients?
So through our education, our health and scientific affairs team, we provide medical cannabis certification education programs. So clinicians can come on to our webinars and learn about how to become a certified practitioner, understand the pharmacokinetics of cannabis, the science behind cannabis, and also integrating how to talk about it with youth, the public health aspects of cannabis. So as we think about access increasing all across the U.S., so not even here in New York, but people traveling in and out of the state, we have tourism, then an increase in adult use cannabis. We have to really think about how do we talk to young people about cannabis usage? How are we safe storing them? And then how are we educating teachers, guidance counselors, right? How are they having this conversation as well in their own realm?
Over the last few months, there have been a good number of articles highlighting issues such as cannabis use disorder, making the argument that cannabis is still unsafe, and even introduced me to a new medical term, scromiting. Right. So how should people interpret or think about these articles?
It's true. I mean, we do see an uptick in cannabis hyperemesis syndrome, or CHS, or scromiting. And what we don't really understand yet. I mean, the research is currently being done, but we don't really understand where it's coming from. We do see it in folks that are using higher THC dosages, concentrates, dabs, for example, or folks that are chronically using cannabis. So if you've been using it for decades, for example, all of a sudden it's essentially you become allergic. You become allergic to cannabis. It could be just a little bit. You could go from an edible to an inhaled version to a tincture, but you're still getting, your body is basically reacting to the cannabis and creating a CHS, basically a diagnosis. You're creating this uncontrolled vomiting, almost dehydration. And I just talked to a clinician actually a few weeks ago, and she said she sees about 2 to 3 patients per shift for cannabis hyperemesis syndrome. And a lot of times those patients get a full GI workup. So what that means is they might think that it's a bowel obstruction, or maybe an appendicitis, or they might think it's food poisoning. So they go through the ED with an extensive and very expensive workup to find out that it's the cannabis that they're allergic to. And sometimes those patients don't believe it, and they'll go to different emergency departments and try to get this, the workup again and again to make sure that everything else has been ruled out. But sometimes it's just, you just have to stop the cannabis. So that's CHS. In terms of cannabis use disorder, we do see that some folks just cannot use cannabis, or they're overusing cannabis. And that's something we talk with mental health practitioners about. I always encourage our practitioners, that's why you have to ask and screen about cannabis use, how often, and perhaps you have to refer out to a colleague, you have to refer to a mental health practitioner to talk about safe use and also how much they're using and why. Perhaps it's, again, anxiety, you're using it for anxiety, but it's really your blood pressure medication that needs to be controlled, and you could be using it incorrectly.
So what would you say is a good source for people with questions, to look at?
Well, we have a wonderful cannabis education library on our website. We have over 35 plus materials, so you can start there. I think we have educational materials for medical cannabis certifiers, or for clinicians, caregivers, for youth as well. So I would say the number one thing is to check out our website.
So finally, what is your message to the general public about why medical cannabis still matters, and what would you want every New Yorker to know?
I think the most important message is to have honest conversations with your clinician. If you are using cannabis and you're interested in becoming a medical cannabis patient, and under the care of your clinician and under a medical cannabis pharmacist at a dispensary, this is an honest conversation that you should have with your clinician. If your clinician dismisses you, which we do see because of stigma, sometimes there are clinicians that just have biases and stigma against plant-based medicine, and I get that, then you get a second opinion, right? I mean, clinicians are a dime a dozen. You might want to talk to another clinician, but keep the conversation in the clinical realm so that you're safe and that you understand the risks. And then when you end up let's say you do get to a medical cannabis dispensary, you can have that one-on-one with a pharmacist.
All right. And what about for parents to get information to speak? And it could be if, they're young adults that they want to speak to, or teens.
Yes, our website. So we actually are launching this huge youth campaign through the OCM. We already meet with over 24 school districts through BOCES, from Lake Placid all the way down to Central Albany, and in New York City. What we want to do, we do these listen and learn sessions, is make sure that we understand different zip codes of New York State and understand what are some of the problems that school teachers are seeing, the guidance counselors, that nurses are seeing, what are some of the issues that families are seeing, and how can we curate an educational campaign for youth and for families so that they can speak with their loved ones in a more competent manner, because someone in Lake Placid that are near tribal nation schools, for example, that are near dispensaries, near reservations, might have a different conversation than someone in Brooklyn, or might have a different conversation than someone in Albany, for example. So that's why our office does listen and learn sessions. We do school-based sessions with BOCES to make sure that we cater to the different populations throughout youth and families.
So finally, is there anything else that you'd like to share before we wrap up today?
Oh, gosh, I think we've covered it all. Herb, you did a great job.
Oh, well, thank you. You did an amazing job. So I very much appreciated this. And people should know, I've been asking you for 3 years to come on. You've always been too busy. So I'm glad that things finally slowed down enough for you to take some time to be with us today. So I very much appreciate it. Dr. June Chin, Medical Director at the New York State Office of Cannabis Management. Thank you.
Thank you.
That's it for this episode of Joint Session, Diverse Voices in New York State Cannabis. If you enjoyed this episode, please leave a rating and review on your favorite podcast platform. It helps more listeners find the show. In addition, please share this episode with colleagues, advocates, and anyone interested in the state of cannabis in New York. Joint Session is produced by me, Herb Barbot, together with executive producer Robert Curtis from SimLab. You can follow Joint Session on Instagram at jointsession.pod, on Blue Sky at jointsessionpod.bsky.social, and on LinkedIn at Joint Session Podcast. If you have any comments, questions, or suggestions on topics, reach out to me at herb.jointsession@gmail.com. Until next time, this is Herb Barbot. Thank you for listening.